Welcome to A to Z Nursing Vlogs. This video will focus on the general female breast anatomy. The contents of this video includes the description of the shape and position of the female breast, description of the structure of the mammary glands, a list of the blood supply to the female breast, description of the lymphatic drainage of the female breast, and the description of the applied anatomy in the female breast. Let's dive into the video. Here we have a diagrammatic representation of the right breast, where the different parts of the breast are arrowed and shown clearly. It is usually conical in shape. It lies in the superficial fascia of the front of the chest. It has a base, apex, and tail. Its base extends from the second to the sixth ribs. It extends from the sternum to the mid-axillary line laterally. It has no capsule. The shape and position of the female breast extends from the two-thirds of its base lies on the pectoralis major muscle, while its inferolateral one-third lies on the serratus anterior and external oblique muscles. Its superolateral part sends a process into the axilla called the axillary tail or axillary process. It is clearly stated in the diagram. Let's see the structure of the mammary gland. It is a non-capsulated gland which consists of lobes and lobules which are embedded in the subcutaneous fatty tissues of the superficial fascia. It has fibrous strands which are the ligaments of Cooper which connect the skin with deeper fascia of pectoralis major. It is separated from the deep fascia covering the underlying muscles by a layer of loose areolar tissue which forms the retromammary space. What is its importance? The main importance is that it allows the breast to move freely. The mammary gland is formed of 15 to 20 lobes. Each lobe is formed of a number of lobules. The lobes and lobules are separated by interlobar and interlobular fibrous and fatty tissues called the ligaments of Cooper. What is actually the importance of these ligaments of Cooper? These ligaments give the breast support by connecting the skin of the breast to the pectoralis muscle below them. It has from 15 to 20 lactiferous ducts which open by the same number of openings on the summit of the nipple. Here we see a mammary gland of the left breast which describes the complete structure of these lobes and lobules. The arterial supply. Number 1. Perforating branches of the internal thoracic, that is internal mammary artery. Number 2. Mammary branches of the lateral thoracic artery. Number 3. Mammary branches of the intercostal arteries. These are the arterial supply to the female breast. The venous supply. Veins are corresponding to the arteries. Circular venous plexus are found at the base of the nipple. Finally, veins of this plexus drain into the axillary and interthoracic veins. The axillary lymph nodes are arranged into 5 groups which lie in the axillary fat. They are pectoral group, subcapsular group, brachial group, central group, and apical group. The pectoral is an anterior group which lies on the pectoralis minor along the lateral thoracic veins. The subcapsular posterior group which lies on the posterior wall of the axilla on lower border of the subcapsularis along the subcapsular vessels. The brachial, which is a lateral group, lies on the lateral wall of axilla along the third part of the axillary vessels. The central group lies on the axillary fat at the base of the axilla. The apical group lies at the apex of the axilla. Apart from this, we have the subclavian lymph trunk. It is formed by union of efferent lymph vessels of apical group. It usually opens in the subclavian vein. On the left side, it usually opens into the thoracic duct. These are the axillary lymph nodes which plays a major role in the female breast. The lymphatic drainage is through the subareolar lymphatic plexus and the deep lymphatic plexus. The subareolar lymphatic plexus lies beneath the areola, while the deep lymphatic plexus lies on the deep fascia covering the pectoralis major, and both of these plexes radiate in many directions and drain into different lymph nodes. The lymphatic drainage in the central and lateral part of the gland, which is 75% drain into the pectoral group of the axillary lymph nodes. The upper part of the gland drains into apical group of the axillary lymph nodes. The medial part drains into the internal thoracic, which is the parasternal lymph nodes, forming a chain along these internal thoracic vessels. In this diagram, we see that some lymphatics from the medial part of the gland pass across the front of the sternum to anastomose with that of the opposite side. The lymphatics from the inferomedial part anastomose with lymphatics of rectus sheath and linea alba, and some vessels pass deeply to anastomose with the subdiaphragmatic lymphatics. The applied anatomy, which includes cancer breast. Cancer breast is a common surgical condition. 60% of carcinomas of breast occur in the upper lateral quadrant. 75% of the lymph from the breast drains into the axillary lymph nodes. In case of carcinoma of one breast, the other breast and the opposite axillary lymph nodes are affected because of the anastomosing lymphatics between both the breasts. In patient with localized cancer breast, a simple mastectomy followed by radiotherapy to the axillary lymph nodes is a treatment of choice. The lactiferous ducts are radially arranged from the nipple, so the incision of the gland should be made in a radial direction to avoid cutting through the ducts. The infiltration of the ligaments of Cooper by breast cancer leads to its shortening, giving pudy or range appearance of the breast. The mammary ridge. Mammary ridge extends from the axilla to the inguinal region. In human, the ridge disappears except for a small part in the pectoral region. In animals, several mammary glands are formed along its ridge. If the contents of this video are informative, like the video and share the video with your friends and colleagues. Thanks for watching.